Sciatica leg pain. What do you do with it? How do you fix it? In this episode of Ask Dr. Walter Salubro, I'm going to answer the question by J. Frey 3725, who asks, can a chiropractor fix a sciatic nerve? Now, let's break down this question. The question is asking, can a chiropractor fix a sciatic nerve? I think what J. Frey is asking here is, can chiropractic help with sciatica leg pain? Right? Because if there's a damaged sciatic nerve, chiropractic's not going to fix that, right? So, but if there's sciatica leg pain, chiropractic can help with that. And what I want you to understand is it's not so much about fixing the pain, but correcting, discovering, so finding and correcting the underlying cause that's causing the sciatica, so the root cause. And the best way to explain that to you is this. Let's say I take a look at the model of the low back. Okay, so here's the lumbar spine, here's the sacrum, here's the two ilia, makes up the pelvis, okay? And then from each side over here are the nerves, right there. So right inside there, okay, the nerves, right? So the lower nerves, L4, L5, and some of the sacral nerves form the sciatic nerve, which comes out from this section here. So what it looks like on a nerve chart is like this. Okay, so here's a nerve chart. So the lower back region, these nerves form the sciatic nerve that goes right down there and distributes right into the back of the leg and into the foot. So if there's any irritation on the sciatic nerve coming out from the buttock region, typically that'll be the piriformis muscle, like a piriformis syndrome, then yes, chiropractic can help with that with sacrum, pelvic adjustments if necessary in that area, and of course some exercises and soft tissue work to work out the piriformis muscles. Now, what if the sciatica leg pain is coming from the spinal nerve roots? So the spinal nerve roots over here, right there, right? So typically an L4 spinal nerve root problem or an L5 spinal nerve root problem will be caused by some form of bulging disc or herniated disc in the lower lumbar spine. So like an L4, L5 disc bulge, or an L4, L5 disc herniation or protrusion, or an L5S1 disc bulge, or an L5S1 herniation or protrusion. And why that happens is, now I'll show you here. So if this area of the disc over here begins to bulge out and irritate this nerve, this L4 nerve or the L5 nerve down here, okay, right down there, just like that over there, okay? So that nerve will also distribute its signals down the back of the leg, okay? So that can trigger sciatica. So now let's say there's a spinal distortion problem. So the spine should be straight down the middle, has this natural elliptical curve when you look at it from the side, and the sacrum should sit in here nice and stable, right? But let's say there's a biomechanical distortion in the pelvis, sacrum, lower lumbar vertebra. There's a misalignment there or a subluxation. Well, that can begin to alter the function of the lower lumbar spine, L4, L5, and the sacrum, sacroiliac joints, and the associated structures such as the ligaments, the disc tissues, which when they're injured creates inflammation, the muscles, the tendons, when they're injured creates tightness, muscle spasms, postural distortions. Basically, when those tissues are distorted from a misalignment or subluxation in the lower lumbar region or sacrum region, it sends bad information to the brain, something's not right. So the chiropractor is really well equipped to correct those underlying spinal distortions, sacral distortions, pelvic distortions that could be irritating the nerves that feed into the sciatic nerve. And we've helped hundreds and hundreds and hundreds of people that come in with leg pain due to either a disc bulge, disc herniation affecting the L4, L5 nerve, or the L4 nerve, L5 nerve, and also even when there's irritation from the sacrum onto the sciatica nerve region into the leg, okay? So what's key is to find out where these spinal distortions are, sacral distortions are, pelvic distortions are, whether it's through postural assessment, manual palpation, neurologic tests, the leg length checks, and also with spinal x-rays. So to answer the question, yes, chiropractic can help someone with sciatica leg pain, relieve sciatica leg pain, and also help that relief last long, and in some cases permanently. So I highly recommend a chiropractic checkup of your spine, your sacrum, your pelvis, your posture, to see how chiropractic can help you. If you enjoyed these Ask Dr. Walter episodes, then go ahead and watch the next ones over here or the past ones over here in this playlist right over here, and you can catch some of the past Ask Dr. Walter episodes.